Why your heart pounds after climbing just a few stairs? Most people think a pounding heart after stairs means they are simply out of shape. You climb one flight, maybe only half a flight. Your heart starts beating hard. Your chest feels busy. You need a moment at the top. You may feel slightly breathless, warm, heavy, or embarrassed. And the first thought is usually, I must be getting old. But here is where people get fooled. A pounding heart after climbing stairs can be completely normal in some situations, but it can also be an early clue that your heart, lungs, blood, muscles, thyroid, or sleep quality are not keeping up with what your body is asking for. Stairs are not the same as walking across a room. Stairs demand more from the body. Your legs need more oxygen. Your heart has to pump faster. Your breathing increases. Your blood vessels adjust. Your muscles have to lift your body weight against gravity with every step. So yes, your heart should beat faster after stairs. The real question is not, did my heart speed up? The real question is this new, worse than before, out of proportion, or happening with warning symptoms? Because after 50 or 60, a change in stair tolerance can tell you a lot. The first reason your heart may pound is simple deconditioning. This is the most common and least dramatic explanation. If you have been sitting more, walking less, avoiding hills, recovering from illness, gaining weight or losing muscle, stairs can suddenly feel much harder. Your heart has to work harder because your muscles are not helping as efficiently. This is where people get fooled. They think fitness disappears only after months of doing nothing. But stamina can drop faster than people expect, especially after illness, surgery, stress, poor sleep, or a few weeks of reduced activity. And after 50, muscle loss matters. Your legs are not just for movement. They are part of your cardiovascular support system. Strong leg muscles use oxygen more efficiently. Weak leg muscles demand more effort for the same stairs. That means the heart may pound harder even if the heart itself is not the main problem. So if the pounding started after a period of inactivity, the answer may be gradual rebuilding, not pushing hard, not proving toughness, just slowly restoring walking, strength, and stair capacity. But deconditioning should not be the automatic answer if symptoms are new, sudden, severe, or paired with chest pressure, dizziness, or unusual shortness of breath. The second reason is blood pressure and stiff blood vessels. As we age, blood vessels can become less flexible. If blood pressure is high, the heart may have to pump against more resistance. Then stairs can make the heartbeat feel stronger or more forceful. You may not feel high blood pressure at rest. Many people feel nothing. But during exertion, the body's demand rises, and the heart has to respond. If the vascular system is stiff or pressure is poorly controlled, you may notice pounding sooner. This is why stair symptoms should make you ask, do I know my numbers? Not just one reading at the doctor's office. Your usual blood pressure, your cholesterol, your blood sugar, your weight trend, your sleep quality, your family history. Most people think a pounding heart is only about the heart's rhythm. Sometimes it is about the pressure system the heart is pumping into. The third reason is anemia or low oxygen carrying capacity. This one is often missed. Your heart pumps blood, but blood has to carry oxygen. If you are anemic, meaning you do not have enough healthy red blood cells or hemoglobin, your body may struggle to deliver enough oxygen during activity. Then your heart beats faster or harder to compensate. You may feel tired, weak, short of breath on stairs, lightheaded, cold, or unusually worn out. You may think you are just aging, but the issue may be that your blood is not carrying oxygen efficiently. Anemia can come from low iron, B12 deficiency, chronic disease, kidney problems, bleeding, poor absorption, or other causes. It is not something to guess about. It is something to check with blood work. This is where people get fooled. They try to walk it off when the body may be asking for a lab test. The fourth reason is thyroid imbalance. Your thyroid helps regulate metabolism and heart rhythm. If thyroid activity is too high, your heart may feel fast, forceful, or jumpy with small exertion. You may also notice sweating, shakiness, anxiety, weight loss, heat intolerance, or trouble sleeping. If thyroid activity is too low, you may feel heavy, tired, sluggish, and deconditioned more easily. The American Heart Association notes that palpitations can have many triggers, and clinicians may check blood work for thyroid problems, anemia, or electrolyte abnormalities when evaluating them. That is why a pounding heart after stairs is not always a cardio fitness issue. Sometimes it is a hormone, blood, or chemistry issue. The fifth reason is sleep apnea or poor nighttime recovery. This is a big one after 50. If you snore loudly, wake with dry mouth, wake with morning headaches, feel tired during the day, or have high blood pressure that is hard to control. Your heart may be starting the day already stressed. Poor sleep breathing can cause repeated oxygen drops and stress responses at night. Then during the day, even small exertion can feel harder. You may climb stairs and feel your heart pound because your body is not fully recovered. This is where people get fooled. They say, I slept 7 hours. But time in bed is not the same as restorative sleep. If your body fought for oxygen all night, stairs in the morning can feel much harder than they should. The sixth reason is a heart rhythm issue. Sometimes the heartbeat after stairs is not just fast, it is irregular. You may feel fluttering, skipping, racing, or pounding that does not match the amount of effort. It may continue after you stop. It may come with lightheadedness, chest discomfort, weakness, or breathlessness. Mayo Clinic explains that palpitations can feel like a fast, fluttering, or pounding heartbeat, and frequent or worsening palpitations should be discussed with a healthcare provider. This does not mean every pounding heartbeat is dangerous, but rhythm changes become more common with age, especially with high blood pressure, alcohol use, thyroid problems, sleep apnea, heart disease, electrolyte imbalance, or certain medications. Most people miss this difference. A normal fast heartbeat after stairs should gradually settle as you rest. A rhythm problem may feel chaotic, sudden, irregular, or out of proportion. If your pulse feels irregular, not just fast, pay attention. The seventh reason is possible, heart or lung disease. This is the reason people worry about, and it should be taken seriously without causing unnecessary panic. If the heart is not pumping efficiently, if the coronary arteries are narrowed, if the lungs are not exchanging oxygen well, or if fluid is building up, stairs can expose the problem earlier than rest does. Cleveland Clinic describes exercise intolerance as limited ability to do physical activity expected for your age, and notes that shortness of breath and fatigue with exertion can happen with conditions such as heart failure or lung issues. This is where people get fooled. They say, I only feel it on stairs, so it can't be serious. But stairs are a stress test built into daily life. They reveal what rest can hide. If climbing a few stairs causes chest pressure, tightness, pain into the arm, neck, jaw, or back, unusual shortness of breath, nausea, cold sweat, dizziness, or fainting, do not dismiss it. The American Heart Association lists chest discomfort, shortness of breath, and pain or discomfort in areas such as the arm, neck, jaw, back, or stomach among heart attack warning signs. And if palpitations happen with chest pain, fainting, or severe shortness of breath, Mayo Clinic advises emergency medical attention. That is not fear, that is wisdom. Now, how do you know whether stair pounding is more likely normal or more concerning? Look at the pattern. If you have been inactive, gained weight, slept poorly, had a recent illness, or avoided stairs for months, and the pounding improves quickly with rest and gradually improves as you rebuild activity, it may be deconditioning. But if the change is new, sudden, worsening, or much worse than people your age doing the same activity, do not brush it off. If you used to climb those stairs easily and now your heart pounds after only a few steps, that is a change from baseline, and any meaningful change from your normal deserves attention. Also notice recovery time. A normal exertional heartbeat should slow down after you stop. If your heart keeps racing, feels irregular, or takes a long time to settle, that matters. Notice breathlessness. Mild breathlessness after stairs can be normal, but gasping, chest tightness, severe shortness of breath, or needing to sit down every time is not something to ignore. Notice other clues: swollen ankles, fatigue, dizziness, pale skin, cold intolerance, weight changes, snoring, morning headaches, high blood pressure, high blood sugar, new medications, heavy caffeine, alcohol, dehydration. Your heart may be pounding, but the cause may be somewhere else in the system. So what should you do? First, do not panic. One episode after rushing, carrying groceries, climbing quickly, or being stressed does not automatically mean disease. Second, do not ignore repetition. If it keeps happening, track it. Write down when it happens, how many stairs, how fast you climbed, whether you were carrying something, how long the pounding lasted, whether your pulse felt regular or irregular, and whether you had chest discomfort, dizziness, or unusual shortness of breath. Third, check the basics. Blood pressure, A1C or blood sugar, cholesterol, blood count for anemia, thyroid function if symptoms fit, medication review, sleep apnea risk if you snore or wake tired. Fourth, rebuild safely if you have become deconditioned. Start with walking on flat ground. Add gentle strength training for legs. Practice stairs slowly, using a railing. Stop before you are exhausted. Progress gradually. Your heart and muscles adapt when stress is appropriate. They struggle when stress is sudden and extreme. Fifth, get evaluated if the symptom is new, worsening, or concerning. Your clinician may consider an ECG, blood test, heart monitor, stress testing, lung evaluation, or other tests based on your history. The main message is simple. Your heart pounding after a few stairs is not always dangerous, but it is never meaningless. It may be deconditioning. It may be weaker leg muscles. It may be high blood pressure. It may be anemia, thyroid imbalance, poor sleep, sleep apnea, medication effects, dehydration, rhythm changes, heart disease, or lung disease. The stairs are not the enemy. They are the messenger. They show you how well your heart, lungs, blood, muscles, and nervous system respond when the body asks for more. So do not shame yourself. Do not panic. And do not dismiss a new pattern as just age. Listen to the clue. If it is mild and clearly related to lost fitness, rebuild gently. If it is sudden, worsening, irregular, or comes with chest pain, fainting, severe breathlessness, dizziness, sweating, or pain spreading to the arm, jaw, neck, or back, get medical help. Because sometimes the heart pounds after stairs because your body needs conditioning. And sometimes it pounds because your body is asking for attention before a bigger warning arrives.